you're here for the cranial nerve exam. Okay, go ahead and take a seat. Could you please confirm your full name for me? Thank you. Just want to make sure that I have the right patient and your date of birth. Great, okay. So, how are you feeling today? Okay, is that why you're in for an exam? Sorry, my notebook is squeaking. So, some slight dizziness, headaches. Okay. For how long has that been occurring? Okay. Do you have any issues with your vision? Any blurred vision, double vision, any difficulty seeing near or far away? Okay. When was the last time you had a full eye exam? Okay. Alright. Do you experience any light sensitivity? Okay. Any changes in your sense of hearing? Any kind of ringing in your ears? Any muffled sounds or anything? Okay, no ear pain or any tenderness around the ear? Do you have any problems with your balance or your coordination? Okay, good. Have you experienced any numbness or tingling in your fingers or down your limbs? Any muscle weakness that you've noticed? Okay. What about in your face? Okay, any twitching or anything strange? Do you have any pain or discomfort in your face or around your eyes? Sometimes the headaches. Does it feel like they could be tension headaches, or where exactly do you feel the pain? Okay. All right. Have you had any recent infections, injuries, or surgeries or anything? Okay, common colds. Are you feeling better now? Okay, good. Good. Are you currently taking any medications? Okay. Is that working well for you? Okay, good. And any vitamins or any supplements? Okay. And do you have any known allergies? Good. Have you experienced any recent changes in your mood or your memory, cognitive function, or anything like that? Okay. Any changes in your appetite, your weight, or your energy levels? Okay, good. And have you noticed any changes in your sleep patterns? Difficulty falling asleep, waking up frequently throughout the night? Occasionally. Okay. Have you been doing anything to manage your pain with the headaches? Okay, and what do you typically do when you feel dizzy? Just kind of relax and chill out. What kind of relaxation techniques do you prefer? All right. Good to know. Well, thank you for answering all of my questions. I'm just going to put some gloves on and we'll get started. I do want to check all of your vitals to begin with, if that's okay. So we're going to check your heartbeat, your breathing, check your temperature, blood pressure, your pulse, things like that. And then we'll go through each of your cranial nerves. Okay. So you just relax for me. I'll walk you through everything, and I don't need you to do too much thinking. I'll just guide you through all of the tests, okay? Alright, so I'm going to check with my stethoscope first. little bit cold. If I could just move your shirt slightly. Thank you. Okay, just breathe normally for me. Good. I'm gonna listen over here. And over here. And down here. Okay, heartbeat is normal. I'm just going to come around to the back here. If you could take a deep breath in for me. Perfect. And then let it out. Good. Alright, take one more deep breath in. Good. And let it out. Perfect. So that all sounds healthy and fine. If I could just see your wrist here, I'm just gonna feel and time your pulse here. Just hold still. Good. And if I could just check on your neck as well. I'll do this side. Perfect. Okay. Do you feel like you have a fever? No? Okay, that's good. We'll check anyways. I'm just going to take this thermometer. If you could open up your mouth, it's going to go under your tongue. Good. Okay. And we'll hold that there just for a moment. Are you having trouble breathing through your nose? No? It's okay. Alright, good. Okay, great. No fever, just what we want. And I do want to check your blood pressure with this device. Do you have an arm that you prefer? Okay, I'll just go with this side. So this is just going to wrap around your forearm here. And you'll feel some slight pressure. Let me know if it's uncomfortable and we'll take it off, no problem, okay? Right. Does that feel comfortable? Okay. Ready? Just going to turn it on. Alright, just hold one moment. And release. Good. Okay. Blood pressure looks a little bit high, but nothing out of the abnormal range. Yeah, it can be quite common for you to experience a little bit of high blood pressure, especially when you're at a medical office, if you're a little bit anxious, but nothing to be concerned about. And that should be fine with the medication that you're on, so I'm not worried about that. Just note that down. Okay, we are going to begin with the cranial nerves now. Firstly, I just want to take a general look at you. If you could do your best to sit up straight, checking your overall appearance. Hygiene looks good. I'm not noting any abnormalities right away with your face, which we'll check a little bit closer later, but no strange rashes or markings, no injuries, bruises, cuts, scrapes, swelling. Can you let me know if you feel any pain as I just touch around your head? Good. Applying some slight pressure. check your face and your facial nerve a little bit more later. So I want to test your eye movement. If you could keep your head nice and still, and I want you to focus on my pen. It has some flowers on it, so just pick a point on the pen or the tip of the pen and just follow it with your eyes. And I just want to see if you're having any trouble following a moving object, tracking it with your eyes. Any pain with that? Any double vision? No. Okay, very good. Can you focus on the tip? I'm just going to move it closer, farther away. Okay, focus right here. I'm just going to move it closer and farther away. Alright, I want to cover one eye. Can you focus on the pen? And again, just follow it with one eye covered. And now I'm just going to see if the other eye is moving as it should. Good. The other eye. Again, just follow the pen. Checking both eyes. A little bit of blurry vision there. Okay, nothing too concerning. Good. Okay. Now you said you aren't super sensitive to lights. Good. I'm going to bring in a light. Could you look at the light? Okay. And just try not to get distracted, firstly, by my gloves. Keep your focus on the light. Look right here. And look right here. Okay. Are you having any trouble focusing on the light? No, it's fine for you. Okay. Alright, okay, now I want to do a bit of a closer eye inspection. Okay, so just look at my nose and let me take a look. Let me know if the light is too bright for you. Just gonna feel around here. Just gonna feel around, check your eyes. Keep looking at my nose. Okay. Good. Okay, could you look up? And look down. Look to the left. Look to the right. Okay, and look back at my nose. Gonna check your pupil dilation. Keep looking straight ahead. Okay, and the other eye. Alright, so I'm going to cover up your eyes, and now I want you to look at the light. Yep, I'm gonna just cover your eyes and look at the light. Very good. One more time, covering up your eyes. Can you look at the light? Very good. Focus on my finger right here. And just try to ignore the light here. Keep looking at my finger. good. Let's check your peripheral vision now. Look at my nose. Okay, and then just tell me when you see my fingers come into your vision. Good. Good. Okay, and look at my nose. Tell me when you see the light. Yep. Good. Great. Good. Yep. Okay, good job. Now just tell me when my finger leaves your vision. Good. Both fingers. Good. 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 Great. Okay. Apologies. My tummy is getting a little bit hungry. Okay. So now I just want to test your vision. Can you see this chart? Alright. And just tell me the line that I'm pointing to. You could just read it out to me. So let's try this one. Very good. This one. Very good. Can you do one below that? Good. Can you cover your left eye? And just tell me the letter that I'm pointing to. Good. 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 Can you read this second to last line? Very good. Can you cover the other eye? Same thing. What is this letter? This one? This one? And that one. And can you read the third to last line? Very good. And what's that color there? And this one? Very good. Let's now use this device here. I'm just going to hold the dots over your eye, okay? And I want you to tell me if you can read the line that I tell you to read, okay? So, can you see a little bit through those holes? Okay. Now, can you tell me what the second line is? Very good. Can you read the third line? Okay. Good. Let's do the other eye. Same thing again. Just put this. Alright, can you read the third line? Okay. Can you read it backwards? Okay. Well, this tool is a little tricky. Good enough. Vision seems fine. Okay. Now we'll do some quick color tests. I just have some object cards here in different colors. Can you tell me what this is? And the color? Good. This one? Good. It's a pink mug. And this one? Good. Yellow bell. What's this? Green watering can. Good. This one? Pink fish. This one? Okay. A bee. Yellow and black. Good. This one? Red and white hot air balloon. Good. This one? Blue elephant. Great. And last one? A red car. Well done. So, to me, your visual nerve, your optic nerve, doesn't seem like it has any problems. That's good to rule out. Normally, if someone's experiencing headaches, that can be the first thing that we would test. But let's move on to your facial nerve, okay? So I'm just going to touch around your face a little bit, do a quick exam. Let me know if you feel any pain or discomfort. Looking at the symmetry, I don't notice any facial drooping. Okay, I'm just going to do something a little unusual. I'm going to take this red light, and this is going to help me to assess your skin texture, look for any abnormalities that might be more difficult for me to see without the light, okay? Just hold still. Okay, notice some enlarged pores, but it's totally normal. Don't see any rashes, any skin conditions that would need further evaluation. T-zone looks good. Texture is normal. Temperature feels good. Okay, great, thank you. Now I just have this metal device, this reflex hammer. I want you to just tell me if the temperature feels normal, so it should be cold on your skin. I'm just gonna hold it on your forehead. Is that cold to the touch? And on your cheek. Yes. And this cheek. And on your chin. And on your jaw. And the other side. And this temple. And this temple. And on the forehead again. And on the nose. Normal? Cold? Okay. Great. Now I'm just going to apply some pressure to different zones of your face. Forehead. And does that feel the same on both sides? Yeah. On your cheeks. Same. And on your chin. Same. Okay. Could you close your eyes and just tell me where you feel a sensation on your face? Forehead. Good. 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 Perfect. Okay. You can open your eyes. Now, could you raise your eyebrows? And don't let me push them down. Perfect. Close your eyes really tight. Don't let me open them. Good. Good. Just feeling your sinuses for a moment. A little bit of pressure. Okay. Can you smile for me? Okay. And can you frown? Okay. Can you puff out your cheeks? Don't let me push the air out. Good. Resist. Resist. Okay, let's do some jaw tests. Can you open your mouth and don't let me close it? Okay, close your mouth and don't let me push your mouth open. Good. Can you move your jaw side to side? Yep. Can you try to push your head into my hand and resist? Yes. And the other side. Good. And from the top. And from the bottom. Good. Okay, I'm just gonna feel right here. Can you open your mouth one more time? Close. Clench your teeth. Alright, just looking at your lips really quickly. Okay, great. Now we just want to take a quick look at your ears and then we'll check your mouth and your nose further. So if you could just turn your head that way for me. I'm gonna take a quick peek inside your ear. Looking for any signs of infection. Anything abnormal. Any pain? Okay, great. You can turn the other way. Take a quick look in this ear. Any pain as I press around? Okay, good. Just pulling the ear back and up. Don't see any abnormalities there. Okay. Could you please close your eyes for me and just tell me on which side you hear my gloves? Good. 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 Both again. Okay, great. Now I'm just going to whisper some numbers and I want you to repeat them back to me. Okay. 7, 9, 8. Good. 2, 5, 6. Good. One more time on each side. 9, 3, 1. Okay. 4, 8, 2. Yes, apologies for my squeaky chair. Okay, that's good. Now I just have this little tuning fork. I'm just going to tap it and I want you to tell me when the sound stops, okay? Alright. There, good. And again. Okay, it was a little quiet. Let's do it again. Okay, and one more time. Alright, good. Well, pleased that your hearing seems fine. Okay, let's check your throat. If you could open up your mouth. Just gonna place this on your tongue. A quick look at the back of your throat. Can you say ah for me? Good. Not seeing any redness, any signs of infection. Okay, looks good. Could you close your mouth and then just push your tongue onto one side? Yep. And the other side. Yep. Okay, just open your mouth a little bit. Just feel again on your lips. Might be a little bit uncomfortable. Just again looking for any ulcers, infections, anything abnormal. Take my light. I'm just gonna hook my finger into the side of your mouth. Check the side. And this side. tilt your head back. Let me just check the roof of your mouth. Okay, and lift your tongue up. Okay, let's do some quick taste tests. Could you just tell me if the flavor is sweet, savory, or sour? Okay, so savory would be like salty. Okay. I'm gonna take a drop here. Good. Sour. Okay, let's do another one. What do you think? Salty. Okay, one more. What does that taste like? Sweet. Okay, great. Now let me take a quick look up your nose. Again, if you tilt your head back, it might be a little uncomfortable for just a moment. Okay, looks good. Could you hold one nostril and then breathe in? Good. And the other side. And breathe in. Okay, let's do some smell tests. Can you tell me what that smells like? That is orange. Yes, very well done. And one more. That is vanilla. Great. I'm just gonna feel your nose. Just assessing for any pain. Does that feel okay? Yeah, you mentioned a little bit of sinus pressure. Could be related to your headaches. Just note that down. Or it could be because you are still recovering from a lingering cold a little bit. Okay. I just want to have a look at your neck. Any pain or stiffness? Alright, could you tilt your head to one side? And the other side. Okay, and back to the middle. Just feeling this area here. Alright, could you shrug your shoulders and try to resist my pressure? Okay, shrug them up. Good. And again. Good. Okay. And could you swallow for me? Yes, very good. Okay. I want to take a look at your arms, kind of your skin area. Just a little bit closer. Yeah, if you just hold your arms out, thank you. Anything I might have missed? Look at your hands. If you close your eyes, can you just tell me which arm I'm tapping? Yep. Yep. Okay. Okay, you can open your eyes. And can you feel all this down your arm? Down your arms? Okay. If you just raise it up, and then out towards me. Any numbness or tingling? Okay. Check this arm. You just raise it up, and then out towards me. Any numbness or tingling? Okay. If you could hold your hands out, I'm just going to inspect your fingernails. Alright, could you make a fist? And don't let me open your fingers. Very good. Hold your fingers out wide and don't let me squeeze them together. Very good. Can you just give me your hands palm up? Take a look at each finger. Again, any numbness or tingling in the hands? Okay, and the other one. No numbness or tingling. Okay. Very good. Just test a couple of your reflexes on your elbow. Okay. Okay. Good. On your wrist. Good. Okay. Relax your knees on the table here. Good. Good. Look at the other side. Good. And relax your knees. Very good. Okay. Let me just palpate a little bit on your chest. If I could take a quick feel of your abdomen as well. Just want to make sure you don't have any enlarged organs. Is that okay? Thank you. I'm going to lift up your shirt slightly. Feel around really quickly. Any pain if I just press here? Okay. And here? And here? And on this side? Okay. Seems fine. Let me note all of that down. You can relax. Alright, so I didn't see anything out of the ordinary with any of your nerves. Did anything occur to you throughout the exam that felt a little off or uncomfortable? Okay, yeah, just your sinuses. They seemed a little clogged. So I think your headaches could be related to that sinus pressure. Headaches also could come on due to your hydration levels. I know everyone always says it, but make sure that you're staying well hydrated, drinking your fluids. If you haven't already, I would really recommend to take note of any patterns of your headaches. When you notice they come on, just write a quick note of any symptoms you're occurring or anything you're doing in particular that could be making your head hurt. Okay? You can keep just like a little diary log. And if your headaches and your dizziness do persist for more than a week or so after today, just give me a call to come back in, and it might be worth getting more of a specialist evaluation. Could be something else going on. Yeah, but if they persist, if they get better, that's great. Alright. Do you have any other questions for me? Okay. Well, thank you very much for coming. Of course, as I said, don't hesitate to reach out if your pain persists, okay? It was a pleasure to see you today. Thank you very much for coming to your exam. Take care.